Assalamu alaikum. Good evening, everyone. Welcome to today's session. And we'll before going ahead with the focus review of benchmarking, we'll start with the quiz related to the previous topics. The previous topics we discussed was utilization management, population health management, risk management, including um, what do you say, the financial management and infection control. So we'll start off with a quiz here. Again, the same methodology. I'll be reading out the question. Wait for a few seconds for you to answer that question, and then we'll go into the discussion. Right now, coming to the first question for today. Like your hospital case management program monitors length of stay by condition. Length of stay for 4 conditions has decreased slightly each of the last 6 quarters. To evaluate cost and quality of care impact, which measures do you recommend? Okay, so the options are option A, denials, comparison with previous 2 years LOS, readmissions. Option B, staff productivity changes, reimbursement, LOS at next level of care. Option C, reimbursement, comparison with conditions with increasing LOS, denials. And option D, outcome of transition plan, reimbursement, and readmissions. What's your answer for this question?
Letter D.
Option D. Right. So effectively, the question is asking like, see, length of stay is going down for some time for several conditions, and we want to know how do we best check whether this shorter length of stay has affected both the cost and quality of care. How is it impacting that? So for this, in a way, like I'm looking for something that's going to answer like, did we save money? That's the cost factor, right? And also the quality factor, like did patients get good outcomes, or did the quality suffer with the reduction in LOS, right? So that's those are the measures that we are going to look in the options. Now for option A, denials mainly relate to payment issues and medical necessity. That's in a way like indirectly cost related. Okay, now comparing with previous 2 years LOS is still just LOS, and that's utilization. That's not comparison with quality or anything, right? So, and readmissions definitely relate to quality and possibly cost also. Okay, but here overall, in a way like it's not clearly focused on patient outcomes after discharge. There's something missing over here. This second part is not convincing at all. Now, option B, staff productivity changes and reimbursement relate more to internal efficiency and payments. That's start productivity is more about efficiency, right? And then LOS at a next level of care. See, next level of care, it's about what happens after discharge, but not directly about patient health outcomes. So it's like operations and finance mix, but quality of care is not captured in this particular option as well. In option C, again, reimbursement and denials, both here, denials and reimbursement, both are like financial, that's fine. Comparing with conditions with increasing LOS. Right. This is more of a utilization concept, not related to outcomes or quality. So in all these three options, there's something that is not related to the question that regarding cost and quality of care impact. Okay. So coming to option D, outcome of transition plan here. This is about how patients are transitioning out of the hospital, right? It's giving us about the effectiveness of our discharge planning, follow up, continuity of care, right? So a quality of care and outcome is being measured in this particular part. That's okay. Now coming to reimbursement, this is speaking about the costs and financial metrics. Okay. Readmissions, again, it's both quality and cost, right? So if length of stay is too short and patients get readmitted, then in a way like see, if the length of stay is too short and patients aren't treated properly, then they are going to get readmitted, right? So these indicators do help us in evaluating the cost and quality both. So the option D, outcome of transition plan, reimbursement and readmissions is the right answer for this question. Now, coming to the next question, in revising the utilization management plan, which of the following is most important to consider? Okay. Option A, external contract requirements. Option B, accreditation survey results impacting utilization management. Option C, utilization management performance measure results. And option D, clinical pathway length of stay variances. What's your answer?
C. Hmm?
Option C. Right. So here in this question, basically it's asking like when you are updating your utilization management plan, what is the single most important thing you should look at, right? Most important to consider right here. So remember, when you are revising any plan in quality or in utilization management, whatever it is, you want to base that revision on how well the current process is actually performing, right? So that's the thing you should remember. Now, coming to option A, external utilization management contract requirements. See, contracts with payers is important. Utilization management has to comply with them. But the question is about revising the plan. Revision should be more of an internal performance and outcome, not related to external things. So I'm going to eliminate this. Option B, accreditation survey results impacting utilization management. So see, survey findings can push changes, but they're only periodically, and it's more of a vague and a single time. So because a single time observation, they are not regular, they are periodic, right? So they are not the primary sort of drivers for the revision. So I'm still not convinced with option B. Coming to option C, utilization management performance measure results. Right. See, these data, your utilization management performance measurement detail results, your data tells you whether your program is actually working. Right. If these indicators show gaps, that's where you are going to try to revise your plan, right? So this particular performance measure data like your denials, your appropriateness of admissions, your length of stay, whatever it is, all this data, right, is going to help you take a decision whether you are going to revise or keep it that way, right? So that's where option C is the most appropriate answer. Now coming to option D, clinical pathway length of stay variances. This it's not a complete picture. Okay, only it's only talking about clinical pathway length of stay variances only. This is more of a one part of the broad utilization management performance, right? So this is eliminated. The correct option is option C. Now, coming to the next question here, in your organization, quality management and risk management are separate departments. As QM director, you see the importance of linking with RM to prevent or reduce risk and maximize patient safety. How can quality management link with risk management on peer review cases? Option A, provide information about peer review actions. Option B, provide information about patient occurrences. Option C, provide aggregate occurrence data. Option D, meet with risk management director regularly in confidence. What do you do as a quality management to link up with as a quality manager or quality director to link up with the risk management department? What's your answer for this question? Anyone?
Letter B.
Option? Sorry, what's the
Option
one you're
Option B, doctor.
option B? Okay, right. So in a way, like in this scenario, see, you have two departments, quality management and risk management. Here it's asking, especially in the scenario of peer review cases, specifically in peer review cases, what's the best way for quality management to link with risk management? That's a question, right? So here, remember, it's about linking quality management with the risk management on peer review cases. That's the question. Now, coming to option A. Okay. Before going to the options, what's peer review? What's the peer review of cases? What does it focus on? It focuses on practitioner performance in individual cases, right? And what does risk management focus? It focuses on identifying and reducing the risk. We all know this. Now, coming to option A, provide information about peer review actions. See, it's more like quality person is telling to risk manager what actions were taken in peer review. Okay, but this may be useful, but this is what it doesn't give a broad view of anything for the department. Okay, so it's only talking about review actions. It's not giving the broad sort of info, so I can still skip this. Provide information about patient occurrences. Now, patient occurrences are like incidents. They may be false, medication errors, etc. Right? So the best link between quality management and risk management on peer review cases is to share this patient occurrence information. Okay, so because see, that particular sharing of information gives risk management a sort of case level data to spot any sort of safety problems in order to prevent the recurrences, right? So the risk manager may need this information about these incidents and occurrences, so it can actually connect these individual cases to risk patterns, overall risk patterns, and will help them to take actions. Okay, so this patient occurrence data is most direct input for safety and risk follow-up. So this is the right answer. Now coming to option C, provide aggregate occurrence data. See, option B is information about patient occurrences. Option C is provide aggregate occurrence data. Aggregate is the difference here. Aggregate means this is summarized sort of data or trended data. Okay, in a way like that helps the risk manager to see the patterns of risk or any sort of high risk areas, or for the opportunities for improvement in the systems. But it's more of a broader in context, right? So this particular option is not specifically tied to peer review. Okay, this is not specifically tied to peer review. That's the reason why option C is not the right one. But in case, in general, if this context of peer review was not given in the question, how can the quality management link with risk management? Then option C would have been a right answer rather than option B, because here option B links to the context of peer review, whereas option C is giving about more broader sort of link up between quality management and risk management. You'll have to understand this particular thing. Okay. Now, coming to option D, meet risk management director regularly in confidence. In a way, like this is more of a distracting option. See, it's nice to meet and have a discussion. Just meeting without any sort of specifics. That's too vague option over here. So I'm not going with this. So correct answer is option B. Now coming to the next question. So again, the same sort of scenario. And here it's asking like, of the following, sharing which data best supports risk prevention. Okay, so it's asking about the link up between the quality management and risk management. Okay, and it's asking sharing which database supports risk prevention. Option A, annual practitioner profiling. Option B, monthly event or occurrence reporting. option C, root cause analysis, and option D, failure mode and effects analysis. What's your right answer?
Option B, doctor.
Option D or option B?
B, doctor.
D, right. So it's failure mode and effects analysis. See, here it's simple. The question you already know. Of the following, sharing which data best supports risk prevention? It's talking about risk prevention. Risk prevention is the keyword over here. And you know what practitioner profiling is? I mean, like, it's more of a periodic review of the performance of the practitioners, um, and a periodic review. This is more of a retrospective one. So in a way, like it tries to identify performance problems, but it's not the strongest tool for preventing risk at the system level. So this is not the right option. Now coming to monthly event or occurrence reporting, again this is also reactive and retrospective, right? It shows us what has already happened, and it helps to identify the patterns, but again this is after the event. So it's not about preventing, it's about reacting. So this is not the right option again. So root cause analysis, we all know the root cause analysis is a reactive analysis after a sentinel event. Okay, so when RCA happens after an event, after usually about it happens usually after a sentinel event. It's very much important. It's a sort of corrective tool, but this is not, RCA is not a preventive tool, we all know that. So I'm going to eliminate this option as well. And we all know FMEA, that's failure mode and effects analysis, is a prospective tool, right? So you look at the process step by step, and you ask how could this particular step or a step fail, and then you'll design the control before actual failure happens, right? So that's a classic case of risk prevention, and that's what the question is asking. So the right answer is option D, failure mode and effects analysis. Remember, in I mean, like, this particular question is reflective of your sort of application of the concepts, application type of question, where it's checking whether you are able to apply what you have learned. In case if it was a direct recall question, it will I mean, like, this is one of the important sort of questions in this particular topic. It will ask what is RCA. RCA is about retrospective one. Failure mode effects analysis is a prospective one, right? So it's about reaction. RCA is about reaction. FMEA is about prevention. So for recall questions, the options will be direct, the question will be direct. As far as application, this is one of the examples of the application question. It's like, to see whether you actually know whether the difference between RCA and FMEA, right? Now, coming to the next question. Again, the same scenario, right? But here the question is about one of the aspects, one of the three aspects of quality discussed in chapter concerning perception. Okay, so the question is, of the following options, how might this aspect of quality best be utilized in linking the quality management and risk management goals? It's talking about the perceptive quality. Okay, we have dealt with this in the initial chapters. The perspective of the recipient or observer of care, we all know. Of the following options, how might this aspect of quality best be utilized in linking the quality management and risk management goals? Okay, so the options are: involve the patient in ideas to improve safety. Option B, teach the patient self-care. Option C, involve the physician in ideas to improve safety. And option D, teach the staff effective hand washing. What's your answer?
Option A.
Option A, right. So here the question is actually asking specifically regarding the perceptive quality. We all know about what the perceptive quality is. Here it's in a way like it's a patient's perspective, right? from the patient's perspective. So we are supposed to look at an option which actually contains the patient's perspective in connecting quality and risk management departments. Now, coming to option A, involve the patient in ideas to improve safety. In a way, like this is clearly a patient's perspective, right? See, when patients share what they feel when they feel unsafe or when they get confused, like let's say there are any sort of confusing signages, right? Or if the instructions were not clear, right? So when they come across certain issues, when they inform both um, uh, inform the departments or inform, whether it may be in sort of HCAP survey or patient satisfaction survey, whatever it may be, right? They may inform, they may report in case if they had a near fall due to poor lighting, or if the floor was slippery, they give a feedback, right? And if that feedback is systematically captured, okay, that links both quality management and risk management, because it was about patient safety, the risk was there, and we are looking to improve the processes and the safety of the patients. The quality management is involved in this. We are taking a systematical feedback, right? We are capturing the systematic feedback from the patient and their attendants. And here, when we are taking this particular thing, involve the patient in ideas to improve safety. We are taking the feedback, we are going to act on those. So here, the perceptive quality from the patient's perspective is being is observed in this particular option. Now, coming to B, teach the patient self care. See, good education to the patient can improve outcome, but it's more about one-sided communication. Here, it's about patient instruction rather than taking input from the patient. So this is not going to qualify. Involve the physician in ideas to improve safety. Again, okay, this is good, but again, this is from the provider's perspective. This is not from the patient's perspective, right? We are going to see the perspective of the recipient of care, not from the provider. So this is not the right option. Teach the staff effective hand washing. Again, this is important for infection control, but not nowhere here. There is a patient's view. It's about staff behavior. I'm going to eliminate this. So the right option is option A. Involve the patient in ideas to improve safety. This is one of the straightforward sort of questions. Now coming to next question. So in a way, like here a large integrated delivery system. It has four acute care hospitals, a behavioral health center, two long-term care facilities, and an ambulatory surgery center. 1 year ago, after cost benefit analysis, the integrated delivery system added a home health agency with investments in a building, staff, marketing, computer system, and other equipment and materials, tracking expenses and revenue over time. When would you expect a return on investment? Option A, after 2 years, at the break-even point, when revenue consistently exceeds expenses, or when patients consistently use agency services. What's your answer?
Option C.
Option C, right. So even after going through all that big question, the main part is, when would you actually expect a return on investment? This is the part, this is the most important question actually, right? So here they did the cost benefit analysis. They did the cost benefit analysis, invested money. Now they are tracking expenses and revenue. The question is asking, like, at what point we can say that they are actually getting a return on investment? That's the question, right? Now, two important things which we discussed in the last session: break even point and return on investment. You all should be knowing that break even point is revenue equal cost, no loss, no profit. Return on investment is the profit beyond what you have invested and earning back and more, right? Now, coming to option A, after 2 years, this is vague. This is generally just a time frame, right? A return on investment is not defined by time. Okay, so in a way, like, this is vague and arbitrary. Option B, at the break even point. At the break even point, in a way like you have recovered your cost, but you are there's no guaranteed, you have not yet generated the return above your investment. Okay, so no profit, no loss. So ROI generally is a profit beyond this break even point. Okay, so this is not the right option. When revenue consistently exceeds expenses, obviously, yes. See here, here, this is the difference. Total revenue has exceeded the total cost, right? So this is where the profit lies. That is where the return on investment is. So option C, when revenue consistently exceeds expenses, that's where the return on investment is present. Okay. Now, option D, when patients consistently use agency services, this is high utilization, but that doesn't actually guarantee the return on investment, because high utilization doesn't always mean high money. Because if the reimbursement, or if the cost, or if the pay is low and if costs are high, you may not still be making money, right? So this is not a guaranteed one. High patients, high volume doesn't mean higher revenue. Okay, so option C, when revenue consistently exceeds expenses, that's when we can say that there's a return on investment. Now, coming to the next question. Most commonly, the primary purpose for incident or occurrence reporting is to record infection rates, identify medication errors, identify adverse patient events, and identify patient grievances. What's your answer for this?
Option C.
Option C. Right. So, simple question. It's asking like, what's the broad purpose of incident reporting system or occurrence reporting system? Okay, so the most common or the primary purpose, that's a keyword. So that means broadest or most inclusive answer, not a narrower one. When we are talking about just to record infection rates, this is more through infection control surveillance system, and not just incident reports. And here, this is a narrower one. Identify medication error. Again, this is a narrower one, because this is only talking about medication errors and not other incident types, because other incidents may be falls or any sort of equipment failures, complications, whatever it may be. So again, that is not covered in this. In option C, identify adverse patient events. See, this is a broad term. Adverse patient events includes all this: medication errors, falls, your wrong side surgeries, HAPUs, many more things, right? So incident reports are the major tool to identify these events. So the option C, identify adverse patient events, is a right answer. Identify patient grievances. This is managed through a sort of complaints, and that's not related to the clinical incident reporting system. All right. So grievance addressing system, or the complaints management system, complaints process, not related to clinical ones. Now coming to the next question. At Sunshine Community Medical Center, occurrence forms are sent directly to risk manager, who summarizes the data and submits quarterly reports of the prior quarter's data to totals and sum rates to administration and the governing body. Okay. Now, why might this process be considered inadequate based on performance improvement process principles? Option A, the process does not include priorities for data collection. Option B, the report does not include data collection tools. The report does not include claims information, or the process does not trend the data over time. What's your right answer?
Option D.
Option D?
D. Yes, doctor.
Oh, right. Option D. See, the question's asking, in a way like, within the question itself, the manager is sending just the last quarter totals and sum rates. Okay. Now, the question asks, from the performance improvement point of view, why is that inadequate? Okay. So, important to note, it does not trend the data over time, right? So we all know performance improvement is all about looking at data over time to see the patterns. It's not a sort of snapshot, right? Now, coming to option A, the process does not include priorities for a data collection. Okay, the question doesn't tell us about priorities or whether they're lacking priorities. So we can't assume that's a problem. I'm going to eliminate it. The report does not include data collection tools. Again, see, we don't attach data collection tools to the reports. Okay, that's not a standard requirement. So I'm not going to say this is lacking in according to PI principles. Now the report does not include claims information. So see, claims, but again, PI principles don't say every occurrence report summary must include claims, right? So again, this is not the right option. Even through elimination, you can come up to option D. The process does not trend the data over time. Okay, so this is the right one because the manager is reporting only the prior quarter's totals and rates, and he's not showing the comparisons of the earlier quarters. If that's the case, you can't see whether you are getting better or you are performing worse, right? There's no comparison. There's no trend. There's no run chart. There is no control chart. There is no trend line. So the leaders are missing the point over here. They can't see whether they are getting better or worse, right? So according to performance improvement principles, we need to see how we are doing over time, right? So that's the thing which is missing. So the right option is option D. Now coming to the next question, over several months, over the last months, in a way like uh, your organization has its adverse events, trips, falls on the ground outside, no serious injury. Okay, so there are although there is no serious injury to date, use this information to answer questions. What can the quality professional do to best facilitate risk reduction? Okay, coordinate FMEA, coordinate RCA, recommend new lighting for the areas involved, or research the events to identify a pattern. What's the answer?
Root cause, doctor, reactive.
Hmm? Sorry?
Uh, Option B, doctor, root cause analysis.
You are saying option B, coordinate a root cause analysis. Okay. So here I beg to differ a little because in the question here, it's about the organization has had a few adverse event. Okay, that may be trips, falls on the grounds, but the important thing is there are no serious injuries to date. Okay, although without no serious injuries. That's one of the important things to consider in this question. Okay. Now let me ask you, when do you initiate a root cause analysis in
If
general?
yes,
Mm,
if incident happened, doctor, and there's
okay, not
yeah, sentinel events and
yes, sentinel event, right? So not every incident does warrant a root cause analysis for us because root cause analysis is very resource intensive. We are supposed to go through it thoroughly and do an extensive work to identify the root cause, right? So you can't expend your energy on every other incident. Here the question is very clear. There are several adverse events, but without serious injuries, right? So we can't consider them to be sentinel events. They are events. They're definitely something which we are supposed to look into, but that may not warrant us to have a root cause analysis in detail. That's the reason why I beg to differ regarding your question, your option. So before going into the right answer, we'll see what each option carries. Here, coordinate and FMEA, again, see, we all know FMEA is prospective tool, right? That's before implementing or redesigning a process. So here, events have already occurred. So this is not going to help us, right? Now, coming to option B, we have discussed root cause analysis is initiated after sentinel events, right? Here, they are events, but nothing that is telling us that these are sentinel events. Okay, so we have several similar events and no serious injury. So full RCA for minor things, again, that may not be a efficient and may not be the closest answer. If even if it is, it might be an answer in a way, but that's not the better answer, because there are other options as well. Option C, recommend new lighting for the areas involved. Okay, here it's directly jumping to a solution without understanding the actual causes over there, right? Maybe lighting maybe might have been a factor, but again, this is not the closest one. Option D, research the events to identify a pattern. Identify a pattern. See, this is a keyword here again. So researching here means reviewing all the occurrences reports. You are looking into all the individual reports, but you are trying to see a trend. You are trying to see a pattern over there without going in depth RCA. Okay. So, I mean, like, it may be simple, like where the fall is happening, or who is involved, or in which ward, or in which place, or in which at which time they're following, right? So that may give us a few sort of clues, and will help us to identify a pattern, right? Identifying pattern is foundational for choosing right intervention. Okay, maybe the lighting itself, maybe signage issues, or maybe the handrails are not perfect, whatever it may be. Of course, at this stage, definitely trying to identify a pattern is a right move, best to facilitate risk reduction. And then in case, if at all we come up with intervention after identifying pattern, we are going to prevent that, right? So we may not come across root cause analysis at all. In case if this option was not there, then probably this would have been a right answer, at least as far as the closest one. But as of now, for me, this is the most sort of appropriate answer. Yes, this option in your handout may have been different, but again, I just wanted to highlight that there are no serious injuries, no sentinel events involved in this. So a root cause analysis for all incidents is not practical, and that's the reason why you are supposed to go through identifying patterns and possible solutions, right? I hope you got the point. Now, coming to the next question. Again, over the last few months, organization experienced several adverse events concerning trips and falls on grounds, although without serious injuries so far. Which of the following offers the best rationale for the quality professionals' involvement in the situation? Here the question is simple, the same scenario, but which of the following offers the best rationale for quality professionals' involvement in the situation? Is it successful pre-work improves team efficiency, successful proactive improvement activities improve processes, successful improvement activities reduce cost, or successful reactive improvement activities minimize recurrence? What's your answer? Okay, let me go through each option over here, because it's the same scenario, right? Because it's the same scenario. In case, if at all we consider RCA to be the right answer for the previous question, okay, option D in this particular question would be right. But, okay, here again, remember, several adverse events have occurred, even though no one has been seriously injured. Okay, no sentinel event. And the question is not asking what action to take, it's asking, like, what is the best reason for the quality professional to get involved? What is the best reason for the quality professionals involvement in this situation? Okay. Now, option A is successful pre-work improves team efficiency. This is more of a vague one. Pre-work team efficiency, they don't really speak about patient safety or risk reduction. Okay, so I'm going to eliminate option A. Successful proactive improvement activities improve processes. Okay. Is this how we are going to involve quality professional in this particular situation? See, this is a strong contender over here. Quality professionals are there to design and support proactive improvements, right? We all know that because proactive improve they get involved, they help in designing, they help in supporting the proactive improvements that make processes safer before any serious harm can occur, right? So in this particular question, in this particular scenario, we already see a sort of warning sign. There are multiple faults. So a proactive process improvement is what's needed over here before anything big happens, before any sort of serious injury happens, before any sort of sentinel event happens. So this is the most nearest answer. Now, successful improvement activities to reducing costs. Again, here the question is never about cost. Here the question is more about safety and not just cost. So cost is the secondary benefit itself. So we are not going to take this option as well. Again, successful reactive improvements, reactive. Okay, this is more about retrospective reactive work and including RCA after something serious has already happened, right? Again, RCA comes after something serious has happened, but in this case we have had several events without serious injury. So in a way, like, it's a chance for us to step in proactively before any sentinel event occurs. That's the reason why I'm not going with this option, and I choose option B for a proactive improvement activities that improve the processes. I hope you understand. Both these questions are linked. In case if we go with any scintilla elements in the question, then probably RCA would have been the right answer over there and in this option as well. But I still go with preventive, proactive improvement activities to improve processes. That's more about preventive thing before anything big happens. Johan, I guess you got the point over here.
Yes, doctor.
Right. Now, coming to the next question. So, one of the best ways for a patient safety program to be effective is to provide anonymity in root cause analysis, individual case review, occurrence or incident reporting, decision making. Straightforward question. What's your answer?
Option C, doctor.
Option C, occurrence and incident reporting. Okay, that's the right answer. So it's more about where does anonymity most encourage people to speak up so we can improve safety, right? So RCA, RCA is done after a serious event, a sentinel event. Participants are non, anonymity is not there at all in root cause analysis.
You're on mute, Dr. Nadine.
Okay, I'm sorry. I was actually muted for quite a few moments over here. So when was the last thing that you heard of me? From this question, should I start from 34th question? Am I
33,
audible now?
Doctor. Yes, Doctor. 33 was not yet done, Doctor.
Right. 33. Okay. One of the best ways for patient safety programs to be effective is to provide anonymity in. You have answered incident reporting system, right? In RCA, obviously, anonymity is not in a way like not possible. Okay. So that's not a main feature at all because after a sentinel event, participants are actually known. And in individual case review, this is a part of peer review process. So there can be confidentiality, but no anonymity. I mean, because reviewers generally know who are involved in that particular case. So this is not the right option as well. Coming to option C, incident reporting. Yes, this is a classic thing. We all know, right? So incident reporting does require non-punitive approach. It should be having blame-free reporting, and sometimes anonymity does help because here, if anonymity is preserved, the staff will come up voluntarily. If they know that they are not punished or if they are not exposed, in a way they will come forward and report things. In case if they fear about being punished or being exposed or getting known, in a way they won't try to report near misses or any sort of minor incidents, right? So in such case, safety program actually suffers. So option C is the right answer. In option D, decision making, again this is a vague sort of option over here because decision making does require accountability, so anonymity is never a factor over here, right? So correct option is option C. Now, coming to the next question, in a cost effective analysis of barcode medication administration system implemented as part of patient safety program, which of the following would be the best indicator of success? Option A, a decrease in adverse drug events from dispensing errors, decrease in adverse drug events from administering errors, a decrease in total medication errors, and a decrease in total adverse drug events. What's your answer?
Option C, total medication error. A decrease.
Option C. Okay. Right. So I would say that's more of a broader answer. Yes, the option C is more of a broader answer. Okay. So here, let's see. A decrease in the question is asking like they have introduced the barcode medication administration system, which is a technology at bedside where nurses scan the patient and medication before giving it, right? So we want to know like what outcome best tells us that this specific system is successful or not. How do we know whether this particular barcode medication administration system is successful or not, right? Here you need to see at which stage this is implemented, the intervention is there, and how it is going to affect. Barcoding is more about drug medication administration system. So we know at the time of medication administration. Okay. Now, here barcode administration may catch few errors, right? Its primary target is about administration. Okay. Now, a decrease in adverse drug events from dispensing errors, if at all that's the case, dispensing happens at pharmacy. If wrong drug is prepared, wrong strength or something like that, barcode administration will catch it. But it's more focused on administration. So this is not a closest one. A decrease in adverse drug events from administering errors. Okay, so this is exactly why the barcode systems are designed and are implemented. Okay, so if you are giving wrong drug, dose, route, or wrong patient, here in this with this particular barcoded system, you will be caught, and those errors will be reduced. So this is more of a right option. Now coming to total decrease, a decrease in total medication errors. See, this is more broader one. If administering errors come down, obviously total medication errors will also come down. Right. So apart from that also, if at all, there are many other steps in medication management, right? They may be prescribing, transcribing, dispensing, whatever it is, right? With this particular system, they all come, I mean, like they are all not controlled. For us to know whether this system is working or not, okay, if at all we look at only in a broad way, like total medication errors, we can't ascribe that decrease to only administrative system. It may have been due to decrease in dispensing errors also. It may have been due to decrease in prescribing errors also, right? So the total number might have been due to any of the steps of medication management, not specially administrative errors. But here in option B, this is directly focused on administering errors, right? With this, we will get to know whether this system is helping us or not. That's the best indicator. I hope you got the point. There's a difference. Total medication errors will have dispensing errors, administering errors, transcribing errors, prescribing errors, every error. So a total, this is a more of a broader one. A total doesn't give us the exact picture for this particular scenario. So this is not the right answer. A decrease in total adverse drug events, again very broad. Okay, this may be due to any cause, not just about administering steps, right? So the correct option is option B. Now coming to the next question, a patient using a large exercise ball in outpatient rehab fractures 3 ribs when the ball bursts and she falls onto the floor. The risk manager tells the patient that all costs of care will be covered. Of the following, this action best represents risk avoidance or prevention, risk assessment or analysis, risk transfer or shifting, risk handling or intervention. What's your answer for this?
Risk reduction. Letter D, doctor.
Risk, right, risk reduction. Okay, so here we all know this is more of a direct, what do you say, a definition sort of questions. The event has already happened, ball has burst, patient was injured. Now the risk manager is actually reacting and responding. He is agreeing to cover all the costs. So the risk is that's already done. So you can't avoid something which is already done. You can't prevent something which is already which has already happened, right? So this is not the right option. Assessment or analysis, again, this sometimes you may come across this, but here the risk manager tells the patient that all costs of the following, that this action best represents. Here he is specifically asking as to this action of the risk manager, telling that all costs of care will be covered. Here it's not talking about the next step or the next thing, right? So assessment or analysis might have happened, but the question is specifically asking about the cost of care. So, and in this scenario, transfer or shifting of risk is also not happening. Okay, in case if at all it was talking, if at all the question was talking about the insurance policy or something else, then it would have been the answer. But here, handling or intervention, they are in a way like here he's trying to reduce the risk. Risk reduction process is happening because by intervening over here, by speaking to them and saying that the cost of care will be covered, in a way he's trying to reduce the likelihood of litigation. He's trying to pacify them. He's trying to he's trying to handle the situation over there, right? He's trying to reduce the risk. So this is a right answer. Now, coming to the next question. Occurrence or event reporting is an example of peer review, root cause analysis, generic screening, special study. What's your answer?
Generic screening.
Generic screening. Okay, right. So here you see generic screening criteria and occurrence reporting is used to flag cases that might need a review in quality or in a utilization review, right? So here Occurrence or event reporting is an example of what? See, peer review. Peer review means it's a sort of evaluation process where the doctors and clinicians review other clinicians. Okay, so occurrence reports may feed into peer review, but the reporting itself is not peer review thing. Right here, these events may help in peer review, but event reporting is not an example of peer review. Right now, root cause analysis again, RCA is more structured, in-depth process after a sentinel event. So here, an occurrence report may trigger an RCA, but both are not the same thing. So this is not the part. Now, generic screening. Generic screening means it's a broad criteria or method used to identify cases for further review. Okay. If an event has happened, if uh, some occurrence is there, okay, event reporting is one of the most common screening tools that we use to find potential problematic cases. So once we get an event report, we know that we are supposed to look into that particular thing in depth. Okay, so generic screening, not focused one. It's a generic screening tool. Okay, and coming to special study is a one-time focused project, right? So on a particular topic, so special study is, event reporting doesn't come under this. Occurrence is I mean, like, this event reporting is more of a continuous and routine, right? So this is not a one time thing, so this is not the right answer. So the correct option is generic screening. Now, the primary purpose of generic screening is to identify adverse occurrences as early as possible, provide data for practitioner appraisal, identify common cause variation or trend occurrence data over time. What's your answer?
Letter A, doctor.
Right, identify occurrence data as early as possible. See, we all know the generic screening is a tool. We have in a way, like, this is where you apply a set of criteria to flag those cases that may need further review, right? So for example, if at all there's unusually longer length of stay, or a sort of what do you say, unplanned return to OT, right? So whatever it is, if at all those things come up, those are if the case is flagged for further review as to why that has happened. Okay, if there was any sort of unplanned readmission or unplanned ICU transfer. Okay, if that particular thing has happened, that's a specific in a way, like, that's a generic criteria, and the case will be flagged. Okay, so why do we actually do this? What's the main goal of doing that particular generic screening? So option A, identify adverse occurrences as early as possible. Yes, because this generic screening is designed so that when a case happens to meet a certain trigger, okay, it is pulled for review to see if there's any adverse outcome, or if there's any quality related issue, right? So the reason is we wanted to have an early detection of such things. Okay, so the triggers maybe, for example, the example triggers may be like increased LOS, or like how we've discussed, unplanned return to OT, or any sort of unplanned ICU return, right? All these things with that particular trigger, that particular case is flagged. We want to look into that particular thing as early as possible to see whether there was any adverse event or was there any quality related issue, right? So that's the reason why we use this generic screening, and option A, identify adverse occurrence as early as possible, is the right answer. So provide data for practitioner reappraisal. This is a secondary use of this particular thing, but primarily this is not the purpose. Identify common cause variation. Okay, common cause versus special cause is more about control charts. It's not a generic screening thing. Of course, in a way, like, we can actually use those statistical control charts and everything to identify any sort of variations, but again, that's not the primary purpose over here. Trend occurrence data over time, more related to incident reporting and indicators. Okay, Generic screening is about selecting cases for the review. It's not about trend. Okay. So the right answer is option A. Coming to the next question, risk management in an organization is most effective when it is responsible for sentinel event RCA, incorporated into organization-wide safety management, integrated with organization-wide performance improvement, or option D, the responsibility of clinical performance improvement teams. What's your answer?
Options C. Option C.
Right. So here, risk management is most effective when the question's asking us to where should risk management sit in overall structure, right? So option A, responsible for sentinel event root cause analysis. Again, here risk management may participate in RCA, but making it the sole responsible for RCA thing, it's not the nearest one. Okay, incorporated into organization-wide safety management. Okay, that looks good. Safety is one dimension, but again, risk management is connected with other things like claims, liability, process design, and everything. It's not just about safety management. Okay, this is a little narrower sort of thing. Integrated with organization-wide performance improvement. Right. This is a little stronger than other options. When risk management is integrated with performance improvement, okay, all that event data, claims, near miss events, everything actually um, helps in risk reduction, improvement, and all these things become part of the improvement projects. Okay, so in a way, like quality and risk management are supposed to be going together. So this is a little more nearer option, and this is the most correct option as well. The responsibility of clinical performance improvement team, again, this is only talking about the clinical side. Hmm? So whereas risk management is for all other areas also, so this is a narrower one. Option C is the right answer. Now, coming to the next question, root cause analysis is the most appropriate PI process for determining cost benefit, evaluating dental care, analyzing sentinel events, performing peer review. Straightforward question.
Option C.
Right. Option C, analyzing sentinel events, is the right answer. So I don't think this question needs any sort of um, discussion as well. Okay. Now, coming to the 40th question, failure mode and effects analysis is what type of review or improvement tool? Again, the direct question. Is it concurrent? Is it focused? Is it prospective? Is it
Perspective.
retrospective?
Perspective.
It's a
Perspective.
prospective. Straightforward question again. And see, don't get confused with concurrent thing. Concurrent review means concurrent means while it's happening, while the cale is being delivered. Okay. So FMBA is not done concurrently; it's done prospectively before initiation of anything, before introducing any new process or anything. We do it. So this is more of a prospective type. We have discussed it throughout last session, and this is repeated multiple times. The reason for repetition is that this is very much important as far as your exam is concerned. RCA reactive, retrospective, FMA is prospective, and preventive, and RCA with sentinel event. These are the most important things you should be remembering. Now, coming to the last questions of this quiz. Here, an 80-year-old patient falls while unattended and sustains a hip fracture. The risk manager tells the family that related surgical expenses will be covered. Quality professional investigates the reason for the fall and reviews all falls on that unit for previous 6 months. Use this information to answer the question. Okay. So the first question is occurrence or fall is an example of breach of contract, malpractice, potential compensable event, contributor negligence. What's an answer for the first part of the question?
Option C.
Right. Option C. Almost a straightforward question over here. Here in this scenario, elderly patient fell, injured, and now organization is likely to pay for that particular care. So here in this looks like something that might result in a claim or in a payment, right? So because the manager has told that the related surgical expenses will be covered. So this fall is an example of what? Okay, breach of contract, no, because in a way like there's no formal agreement, nothing like that promised thing. So nothing related to the question. Malpractice means professional negligence, right? In a way like malpractice is professional negligence proven as a legal finding. So at this point we just know that the event has occurred. There is we don't know whether there was any sort of professional negligence or not. So in a way like that is supposed to be done from the legal point of view. So that's not mentioned anywhere. Malpractice we are not going with. Contributory negligence, again, that would suggest that the patient's own actions contributed to the harm, right? So there's no information regarding how in this particular question there's no information about how that event has occurred, so we are not going with any sort of assumptions. And we all know this is a potentially compensable event. So potentially compensable event means an event that may lead to compensation. Okay, such an in case if an injury happens where the organization is willing to pay for the cost before any sort of claim is filed or lawsuit is filed, right? So option C is the right answer. The action of risk manager is an example of. Here the risk manager has told that the surgical expenses will be covered, right? So this action is an example of risk identification, risk prevention, risk analysis, or risk intervention. What is it?
Intervention.
Intervention, right? Because identification means the first point where they would have recognized that the fall has happened, right? And risk prevention means we can't do over here in this scenario because the event has already passed. Analysis means, yes, in a way like studying why the fall has happened and what are the contributing factors and everything. But here it's specifically asking the action of the risk manager in this particular question, where he's confirming the family that the related surgical expenses will be covered. That's in a way of risk intervention. And again, within this risk intervention also, this is more about a risk reduction. He's trying to reduce the risk potential lawsuit in the future and all, right? So before going for any sort of further escalations and all, he is trying to pacify them. There's a sort of intervention risk reduction as well. We have already discussed this sort of similar case earlier in this quiz also, right? With that, we have finished the quiz part for today, and now we'll have a focus review of the benchmark. Okay.